Dr. Jason Theodosakis is a sports and preventive medicine specialist who teaches at the University of Arizona College of Medicine. Good morning.
Good morning, Hannah.
Remind us what osteoarthritis is.
The cartilage on the end of the bone breaks down, the bone changes, we get stiffness, we get pain and disability. Number one cause of chronic pain.
Wow. I know that I broke my ankle a couple of years ago. I'm in my mid-40s, and even at that time, doctors were saying, look, you have an injury, you have to worry about arthritis. Do young people actually have to worry about this? Because we think of it as an older person's disease.
One of the messages I want to bring across today is that this happens in our teens and 20s and 30s. We often don't feel it for years and years later. So it's up to you if you want to get arthritis at a young age or prolong it until it's later in life.
So you can actually have it and not feel pain, is that correct?
Most of the time, people have stiffness, or they may have crunching or grinding, and that's early osteoarthritis. And
so I heard your knee right there. Does that mean?
I used to be in a wheelchair. I had a lot of sports injuries, and really I wrote this book, The Arthritis Cure, to get out of the chair and help change the course of the disease, and that's what osteoarthritis treatment is all about.
A lot of people suffer injuries, and all of us are vulnerable. So let's take a look at some of the ways that we can prevent the onset of arthritis. And you say the first thing is to really get control of our weight, right?
Weight is significant. It's not only how much you're loading on the joints, but there's a circulating metabolic factor, something in the blood that breaks down non-weight-bearing joints such as the hands and the fingers.
So that's a huge thing. You also recommend doing exercise that doesn't damage your joints. What kind of exercise are you talking about here?
Swimming, biking, weightlifting, things that strengthen the joint without a lot of load and impact. So jumping and sports activities and jogging can put a lot of strain on the joints.
So not a lot of weight-bearing exercises?
Well, you want weight-bearing, but you want things that are not impact loading, twisting, jumping, things that make you prone to injury.
Got it. You also say proper body mechanics are important, not only when you're working out, but even when you're lifting something, correct?
Yeah, the things we do on a daily basis add up over time, over the years. So you want the proper form, whether you're playing sports, lifting, carrying, whatever you do, the proper form is really important.
Give me an example.
Picking up your laundry baskets. How do you lift? You want to do it right so your back doesn't hurt.
Right, you don't bend over and do it this way.
Exactly.
I know.
And over the years that really adds up.
Yeah, okay. All right, so that's something to keep in mind. And you also say that certain supplements can actually help us?
And this is the big news. Glucosamine, chondroitin, there's a couple others. These actually help stimulate cartilage, prevent the breakdown. Some long-term x-ray studies show people have less joint replacements if they stay on them. But use them properly. Take the right dose, 1,500 glucosamine, 1,200, 800, 1,200 chondroitin. Stay on them for a long time. Don't just judge the symptoms, because they actually help change the structure of cartilage over time.
And do that in conjunction with your doctor, obviously.
Absolutely.
Right. Okay, thank you so much.